Uganda has failed to adequately finance its health budget financial year after the other since the 2001 Abuja Declaration, a commitment by African Union member states to allocate at least 15% of their national budgets to health. This financial year, government allocated 8.1% of the national budget to health, equivalent to 5.87 trillion shillings. This is a slight increment from the 2024-25 financial year's 4%, or 2.95 trillion for health alone. The consistent underfunding for the health sector could partly explain why you are charged when you seek healthcare services in government facilities. On several occasions, this also hinders the way our health system functions. For example, while launching results from a study on lung cancer, health experts expressed worry on the future of diagnosis following the closure of the research project that funded the critical areas.
This thing, the biopsy, is very expensive, about $300. Most patients cannot afford. So now this project has been paying for that. Yeah? All the costs involved, the project has been what? Paying. Now it is going to stop. I am sure pulmonology ward is going to start filling up again. Most of our patients will die before they have arrived to us.
Government's efforts to offer specialized healthcare services cannot be fully achieved because of the shortages in funding.
Lago National Referral Hospital, they are high-end procedures. We ask patients to pay something for those procedures. And we want to encourage everybody, to encourage people to contribute for their health care, because government will not manage to meet that cost. We have not brought on board the health insurance, and I can assure you it will be hard for government to meet that cost. We have managed to revive the MRI services. Without people contributing to that equipment care, we shall not sustain it. And then you'll end up going in the private place to pay 3 times as much. So please give that small contribution and help us to sustain the service, and we all enjoy the service.
But we need to make sure that money is allocated to some of these super specialized services, such that if we ever need them, we can use them.
According to Dr. Charles Ayume, who formerly chaired the Parliamentary Health Commission, much of the budget allocated to government specialized hospitals ends up in wages and consumables, a disadvantage to the operations.
You know, there are basic services that we can provide free. Antenatal care, immunization, basically maternal and child health services, treatment of certain infectious diseases. But as we go up into what we call specialized and super specialized care, the number, the caliber of specialists you need, they come at a cost. The equipment that you need comes at a cost. The infrastructure and so forth, the wear and tear is all expensive. So we are saying, can at least the public pay something, however small it is, for the maintenance, for the consumables, for the supply? I would want to tell you, like, for example, when it comes to dialysis, each filter which is you dispose is about 279,000 shillings, close to 300,000 shillings. That is just the filter. You're not looking at the wear and tear of the machine and so forth. But we are putting our dialysis between 80 to 120,000 per session. That means government is subsidizing a lot. When you go to CT scans, when you go to cardiology, oncology, and so forth, now our question we should be asking ourselves is, should we have free services, but every time you go, the machine is broken down, there are no filters, and we're happy that the services are free, but the machines are not working. You've deployed a very beautiful machine in an up-country remote area, but you don't have the requisite specialists, the number of specialists.
The Permanent Secretary in the Ministry of Health, Dr. Diana Atwine, explains that they are advancing discussions on the revival of the cost-sharing policy.
Cost sharing used to exist, but I think there was a problem along the way in implementation, and I think the president and cabinet and as top policymakers stopped that. However, we still left a window of private wing, which are not really fully functional, I must say. Alternative health financing has worked the whole world over. What we are talking about is not new. We are not talking about something that we are reinventing the wheel. Many countries, including the rich countries, in the UK, in America, all those rich countries, you will not walk into a hospital and get free care. You must contribute through insurance. So here, although we think that the money we get is sufficient to deal with the problems, it is not. It will never. And no country has provided 100% health care to all the needs. No. They have done that through contributing. And then the other person also comes, except the indigents, so the people who are really, they have no job, they are very poor. Those ones the state takes care of. But we have middle class. Our middle class has increased. And therefore we need to embrace national health insurance as a matter of urgency. Number two, other countries have looked at ways of raising more money through cost sharing in hospitals, where people come and contribute. And here, that policy is not yet. And we are going to discuss, we are going to revive this, and we shall go to our policymakers, we'll go to cabinet, and present the challenges that we are having. Even when we get increment in the budgeting, you will never, for example, if I have a CT scan or MRI and I'm going to run that, the current budget will never service those machines. If I have to provide all the tests in our hospital, the reagents that I need in the hospital, with the current budget, I will never. So that's why we still have those gaps. But I do believe that if our policymakers open up this and we are able to discuss really openly, I think that it is the way to go, to have alternative financing to meet that gap. Yes.
So what is still stifling national insurance?
Public health experts have on many occasions urged government to end the presumption of offering absolute free healthcare to the public because it's not sustainable. Walter Mwesigye, NTV.